Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer, A, B or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a hepatologist Dr. Pedro's presentation on fatty liver disease. You now have 90 seconds to read questions 31 to 36.
My name's Dr. Pedro, and my presentation is about fatty liver disease, a fascinating, though rather complex, topic. And that probably explains why, among our patients, there's a lot of misunderstanding about the role of the liver, how fat accumulates, and when and why it becomes a health concern. To my mind, this largely stems from the rather loose use of the term, particularly by journalists and others, which leads to fatty liver disease being misunderstood by many patients. As doctors and nurses, we need to find a way to explain what fatty liver disease really is, in simple terms, and why it matters, starting with the basic science. It's long been established that the liver plays a crucial role in processing fats and detoxifying the body. Without it, the body wouldn't be able to function properly. But when excess fat accumulates in the liver, whether due to obesity, poor diet, alcohol consumption, or metabolic issues, it can cause inflammation, scarring, and even serious complications like cirrhosis. Over time, this can impact liver function and increase the risk of diabetes, heart disease, and other health problems. We often talk to patients about different types of fat accumulation in the liver as a way of simplifying complex medical terms, because there are varying degrees of fatty liver disease. For example, simple fatty liver, steatosis, involves fat buildup in the liver without significant inflammation, whereas non-alcoholic steatohepatitis, NASH, can cause inflammation and scarring, potentially leading to cirrhosis. Using labels like mild and severe fatty liver disease, while somewhat simplistic, can help patients understand that we need to look at the entire picture, rather than just focusing on the total amount of fat in the liver. Advanced liver function tests, imaging, and biopsy can provide essential information about the extent of liver damage and help us identify patients who require closer monitoring and treatment. Patients can sometimes be reluctant to engage with the issue of fatty liver disease. As we know, early intervention is crucial, but many don't see the urgency, especially if they feel perfectly fit and healthy. What they often struggle to grasp is that fat can be silently accumulating in the liver, leading to inflammation and scarring without obvious symptoms. Over time, this can result in serious liver damage, increasing the risk of conditions like cirrhosis and liver failure. That's why it's imperative for those in high-risk groups, especially individuals with obesity, type 2 diabetes, metabolic syndrome, or excessive alcohol consumption, to undergo regular screenings. These may include blood tests to check liver enzymes, imaging tests like an ultrasound or fibroscan, and in some cases, a liver biopsy to assess the extent of damage. Monitoring these factors helps identify patients who need lifestyle changes, or medical intervention before the condition worsens. Preventive medicine plays a critical role in addressing fatty liver disease, especially as it has become increasingly common. It's estimated that a significant percentage of adults, particularly those in high-risk groups, have some degree of liver fat accumulation. While genetic factors may contribute, in most cases, it stems from poor diet, obesity, and sedentary lifestyles, patterns often established over a lifetime. This is why we shouldn't wait until patients develop advanced liver issues to talk about prevention. It's essential to educate younger individuals about the importance of a balanced diet, regular exercise, and maintaining a healthy weight. But it's not just about food and activity. Stress also plays a role in how the body stores and metabolizes fat, including in the liver. Research suggests that people under chronic stress may experience hormonal imbalances that contribute to liver fat accumulation. Additionally, stressed individuals are more likely to engage in unhealthy behaviors such as poor eating habits, excessive alcohol consumption, or smoking, all of which can worsen liver health. Traditionally, lifestyle modifications have been the first-line approach for managing fatty liver disease, focusing on diet, exercise, and weight loss. However, in more advanced cases, medications are being explored to help reduce fat accumulation and inflammation in the liver. One promising treatment is semaglutide, a drug originally developed for diabetes and weight management, which has shown potential in reducing liver fat and improving metabolic function. Unlike some other medications that require daily doses, semaglutide is administered as a weekly injection, making it more convenient for patients. Additionally, researchers are investigating new therapies targeting specific pathways in fat metabolism, including drugs that reduce oxidative stress and inflammation in the liver. These treatments aim to prevent liver damage while having fewer side effects compared to older approaches, which sometimes caused gastrointestinal discomfort or metabolic imbalances. The new approach to treating fatty liver disease involves mechanisms that target specific pathways in liver fat metabolism. One promising method is gene silencing, which works by disrupting signals that contribute to excessive fat accumulation or inflammation in the liver. It doesn't alter the genes themselves, something that often raises concerns, but instead modifies how certain proteins are produced, helping the liver function more efficiently. Gene silencing bears no relation to gene editing, which is often misunderstood. The first such medication was ptisiran, licensed in 2019 to treat amyloidosis, and researchers are continuing work on similar treatments for conditions like Huntington's disease, preeclampsia, and metabolic disorders. As these innovative treatments evolve, we should be looking ahead to the future of liver disease management, where targeted therapies could help prevent fatty liver disease from progressing to severe complications like cirrhosis or liver failure.